Today, a baby will be born among the many impoverished of the developing nations of the world. A baby never blessed with the basic comforts and securities of a middle-class Western household. A baby who will never be vaccinated, never have access to procedural health care, and never be able to afford potentially life-saving medical treatments. This baby, like many others of its stock, will suffer under the cold hand of health disparity, a killer that has struck through the likes of malaria, cholera, and yellow fever, turning the unfortunate deaths of a few into a ruthless massacre. Health disparity, as defined by the CDC, is the preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. And it isn't unique to corrupt, faraway lands. The reasons it manifests, the extent to which it harms, and the amount that can be done about it varies. Every nation of the world is affected by health disparity.
Hello, my name is Lara Wiggins. I'm a doctor of medicine. I specialize in pediatrics, and I have been doing this for almost 43 years now. As an expert in pediatrics, I go on mission trips to Jamaica. We go 4 times a year. The first trip is in February, May, August, and November, where we have clinics Monday through Friday, and we see upwards of 100 to 120, 130 people a day. And these patients are provided with completely free medical care. There is absolutely no fees, nothing. They can walk in, they get assigned a number, and be seen that day.
Jamaica is one of many developing nations where the poverty-stricken masses have been ravaged by health disparity. Available, up-to-date medical treatments are scarce for those living in poverty, and access to proper treatment can often be determined by one's wealth. The high rate of both communicable diseases and chronic illnesses creates a swarm of patients that the poorly funded hospitals cannot handle. While the impoverished may be able to receive healthcare for free, the hospital is only able to treat so many of them.
So the poor get harmed because they can't have basic medical care, and the rich tend to get excellent care because they have the means to be able to get it. And so one of the good things about that is Jamaica has realized, they are looking into this problem. They realize that there's the people improvised, people are not getting the care that they need. So they have developed it's called a health system strengthening project, which is going to be $100 million project over 5 years. And what they're planning on doing is they haven't had a new hospital in Jamaica for over 25 years. So you can imagine, what they have is falling apart. When patients go to the hospital, like if they have to have surgery, they have to provide the medical equipment. They have to provide their own bandages. If you get admitted to the hospital, you have to supply your own bed sheets, your own food. And if they provide medications, that's probably the only thing that'll be free. But everything else they have to cover themselves. So, like I said, you have money, you get excellent medical care. You don't have money, you don't. You just have to rely on what's available. So basically, the people who don't have, the 80% of people that don't have a health insurance rely on very basic care, which basically is non-existent.
The nation's hot, humid climate condemns its people to mosquitoes and mosquito-borne illnesses, all without the relief of commercial repellents common in the Western world.
Some of the diseases in Jamaica are tied to the climate, like they have a lot of skin infections, fungal infections because of the humidity, and so, but those are preventable in that the patients, if they're aware of what it is, they can do some things to prevent themselves from getting it. The other thing is, infectious disease and then getting the vaccination rates also, like for tetanus and things like that. The stats that I saw for babies, their vaccination rate is 91%, which is great, which is much higher than the U.S. actually. So the kids who are growing up now will be vaccinated, and they are more aware of what's. The older generation, not so much.
In spite of the overbearing presence of fungal and viral infections which vaccines can protect against, the vaccination rate among Jamaica's elders is alarmingly low.
And a lot of the people sort of have their own set ways in Jamaica because they're uneducated. But the school kids, they're coming up, they're learning, so they will be able to educate the elders, kind of thing. So if they start in the schools, then they can start spreading the word, basically. Yeah.
In stark contrast to Jamaica, the United States, as the world's premier superpower, has the resources and the technology to provide the same baby with those simple privileges. This prosperity makes the nation seem far better off in comparison to others.
Dr. Raj Ratnam, I usually just go by Dr. Raj. I've been an emergency room physician at, it's now Cleveland Clinic Mercy Medical Center for 21 years. I actually grew up in Canada and did my med school there, and then have been here for about the last almost 30 years. And currently I'm an emergency room physician there.
The greatest difference between the United States healthcare system and that of most other Western nations, as well as many other countries around the globe, is its lack of universal healthcare.
So American healthcare system is tricky because it's different in a lot of states. So where we're at here, it's actually pretty good because even if you don't have health insurance, you can still go to a hospital. You're still going to get care. You'll actually get pretty much the care you would have even if you didn't. We still have, a lot of people that will get care and they actually just won't reimburse the hospital or, the providers, but they still get their care. But there are some places where if you don't have health insurance, you really can't get a lot of care, and that hinders a lot of it. We don't have a universal healthcare system, which a lot of countries have, which helps, but the flip side to universal healthcare systems there are waits. There's all, in our system, I think it's geared on quickness. If you fall and hurt yourself, you kind of want an x-ray right away, you want to see someone right away, whereas sometimes in universal healthcare systems, it does take some time to get those. But I think so I grew up in Canada, so we have a universal healthcare system, but you just kind of get used to, maybe not having everything done as quick as it is here. The flip side to having things done quick is it adds a tremendous amount of cost to healthcare, and that's kind of what causes the healthcare budget to go up. It causes a lot of cost to the system. So access to healthcare, it would be nice, in one way it would be nice if everyone truly had access to healthcare, where a lot of people don't, but that does entail a lot of costs, and the country probably has to figure out how they would pay for that.
Healthcare was then left to stagnate until the emergence of a lethal disease.
Do you think anyone could have been prepared?
As much as the rest of the world.
So I don't think anyone is prepared. They just no one prepares for this.
It's truly an unprecedented situation.
This virus doesn't discriminate. It attacks everyone.
I want every American to be prepared for the hard days that lie ahead.
The coronavirus has changed life as we know it across America.
Breaking developments in the coronavirus emergency in the U.S. and around the world.
Jamaica now has 32 new confirmed cases of COVID-19, pushing the country's total to 105.
South Korea added over 185,000 new coronavirus cases as of midnight today, the figure below the 200,000 mark.
The coronavirus pandemic affected the nations of the world in a variety of different ways, but always in ways unprecedented. Healthcare systems were revamped, economies were strained, and the daily lives of millions were flipped upside down by both the disease itself and the restrictions needed to combat it. Those afflicted by COVID experienced fevers, headaches, coughing, shortness of breath, and the loss of their smell or taste, with the severity of cases varying wildly on a patient-by-patient basis. Among those with one of the more severe cases of COVID-19 is a school teacher at Sutter Elementary, Mrs. J. Kish.
I didn't fare well, so it just was a long process, and a lot of it I don't remember. I remember going into the hospital and for about a day, and then the next month I don't have a lot of memory of it. It's been a little over a year and I'm still working through all of it.
The effects of COVID can be as long-lasting as they can be severe.
I had no real health concerns before I went into the hospital, but now I have some heart issues. I had a small heart attack when I was in the hospital on the vent, and I'm still kind of working through that. When I got there, I would have never guessed that I would have been there that long. I guess that was the biggest surprise. And, waking up and realizing that I had been in there that long.
Mrs. Kish was able to receive treatment in the United States, a country that seemed well prepared for a pandemic, yet dealt with the coronavirus as well as, if not worse, than less developed nations. Towards the start of the pandemic, around March 2020, the US dealt with the unfamiliar and rapidly spreading disease as well as any nation could be expected to, even handling the virus well in some capacities.
So the one good thing we have is we do have resources, so we were able to get the resources, once we found out we were short of masks and things, we were able to get them relatively quickly, months, but we were able to get them. We do have a lot of hospitals compared to population, so we at least had places where people could go when they got really sick. We still had lots of waits in the waiting room, and the ERs, our ER was packed, but at least we were able to get to people, not as fast as pre-COVID conditions, but we were able to get to people.
However, the United States' approach to the pandemic was more defined by its failure than by its success.
The thought with all these pandemics and illnesses, listen to the science, because science is pretty neutral. If it's done right, science is neutral, it's just information. And with that, I think maybe we didn't listen to some of the science, even with some of the, when you should be masking, when you should not be masking, when you should stay home from work, not stay home from work, when should you be tested. Even now we still haven't figured it out, just because I think everyone wants to, people want to get back to normal life, the politicians want to get reelected, and it's, it's not very popular to, have people sequestered at home, missing work, that sort of thing. We have a lot of people that don't get paid if they don't go to work, and I think that is a big issue too.
While the United States' subpar response to COVID-19 exposed some of the flaws in their healthcare system as a whole, nations like Jamaica have taken the opportunity presented by COVID to revolutionize their own systems.
They will focus on getting the basic care that people need, and then also expanding the hospitals to have more staff, more equipment, so that patients don't have to provide their own support system kind of thing. That should be supported by the government. So what they want to do is they want to increase the capacity of the health centers and the hospitals, so that means they can provide more care to the people. Disease prevention and treatment to meet the specific needs of the individuals also have linked information systems, so like the electronic medical records.
Like many other states around the world, South Korea seemed as though they would be devastated by a pandemic like COVID-19, especially when compared to the United States. However, they performed shockingly well, far exceeding the world's expectations.
South Korea adopted legislation that allowed the government to collect cell phone records, credit card transactions.
Perhaps the most impressive part of South Korea's COVID procedures is the fact they didn't have to implement any of the major economic or domestic shutdowns seen in other countries. This factor of their policy, according to the Brookings Institute, safeguarded families and businesses from additional harmful costs. South Korea's success was aided by the willingness of its citizens to cooperate with government officials, wearing masks and following contact tracing guidelines. This willingness likely stems from the MERS, or Middle Eastern Repository Syndrome, outbreak in May of 2015. South Korea struggled to handle the outbreak, and that struggle would both inspire the government and the healthcare systems to better prepare for future outbreaks. Nations, like the United States, that handled the pandemic poorly in spite of their wealth and power, ought to learn from South Korea, particularly from their methods of contact tracing and the speed they managed to administer COVID tests and vaccinations with.
So I think the COVID vaccines are good. I think that's why our numbers are getting better. So with COVID, I think the rule is to look at it as you want to survive in advance. If you can't survive it, you don't get to the next stage. And the vaccines don't mean that you may not get COVID, but they greatly reduce the chance you can get really sick from COVID or die from COVID. And that's kind of the point of the vaccines. They're generally not meant to, even flu vaccines, you may still get the flu, but generally you won't get a severe case if they get the right strains. And with what we're seeing, we have a much higher percentage of people vaccinated. Even in the ER day to day, we're seeing less people in our peaks than we were in our previous peaks when the population was kind of unvaccinated. So there's less people that tend to get really, really sick and tend to plug up the ICU because they're on vents or nearing on vents or on life support. And so I think the vaccines are a great idea. They and also it'll help, I think, everything get back to normal, because everyone's been sequestered at home, and honestly everyone is suspicious of the person next to them, if they're coughing, if they're doing what, because no one knows who is what, and our vaccination rates are not great compared to some other countries, but we still have access, and I think that the population that has gotten vaccinated, it dramatically decreases the risk for people that are immunocompromised, because there's less people to get them sick, but also minimizes the amount of people in healthcare, like in the hospital, in the ER. So when other people do come in with other emergencies, we still have staff able to treat them. The COVID vaccine, there is a small population that can get things like myocarditis, but myocarditis is like an inflammation of the heart. Generally is short-lived and treated, goes away, and they make full recoveries. But again, that is a very small side effect of the vaccine when you look at the numbers, but none of these are 100% safe. But the risks of COVID are so much more than the side effects of the vaccines. So when you look at the grander picture, that's kind of how you survive the pandemics. You survive to the next level, get a larger amount of people that are vaccinated, and you look at who we've seen, the side effects of from vaccines are minimal. We've seen the odd person here and there, and most of the side effects are short-lived.
Tomorrow, a baby will be born in a world of constantly improving healthcare, into the arms of parents who needn't fear for their child's health. A baby who will grow into a healthy, thriving child under the guidance of that healthcare. A child who will mature into an adult who won't struggle to find medical treatment based on the circumstances of their birth. This upward spiral can only continue as long as healthcare keeps improving and as long as vaccinations continue to spread further. Anyone able to receive the vaccine without underlying medical concerns, like allergies to its contents, should. The more people protected by the vaccine, the less damage that the coronavirus can inflict farther.
Sometimes, with vaccines, which I think vaccines are a great idea, you may not be getting vaccinated just for yourself. Maybe you're getting yourself vaccinated for your neighbor who has a kidney transplant or some other transplant, solid organ issue, and those are the people that are actually the ones in danger. Their lives have changed a lot because the vaccines don't work for them. And it is a jump, when a lot of people think of vaccines, well, what will it do for me? And a lot of, people, especially younger people, will, they actually tend to do okay. Some people still get really sick. We've had a number of young people that have died from COVID, but what it really helps is the community. And sometimes I think that people have a tougher time grasping, if I do something, maybe it helps my neighbor or someone that I don't know. And those are the unmeasured benefits of it.